Thank you. I assumed that I would now be seeing the introductory screens on the Pandemic Disaster Preparedness Center. It is. May I go to the next one? Yes, to give you a little bit of background. For those who aren't familiar with us yet, there are 4 academic leads. Marion Koopmans, well-known virologist. Bas Jonkman, he's at the TU Delft. His expertise is in flood and in crisis management. To the far right is Anja Schreier. She joined us most recently. She's also now connected with the Erasmus Medical Center. Her expertise is public health, and I am sort of in the middle. I'm at the University of Rotterdam, and I'm a professor of sociology. Next slide, please. Yes, this is a complex slide, but I'm going to take you through the 4 corners of the slide. We talk about pandemics and disasters, and the top left-hand corner, you see a focus on pandemic preparedness. And that's where it's a focus on increasing threats, the increasing threats of being encountered with zoonotic diseases. So those are diseases that jump from animals to humans, an increasing risk of what are called vector-borne diseases. So diseases that come from the bites of mosquitoes or ticks, for example. Take you to the bottom left corner, disaster preparedness. Here we're talking about extreme weather or floods or other kinds of disasters. Why are we looking at them together? Because even the fact that they're both linked through something behind it, and that's of course climate change, changes in modes of economic production, changes in modes of consumption, but even changes in our climate increase both the threats of floods and they again increase the likelihood of outbreaks of all kinds of diseases. And right now, Ukraine is a living example of what's happening and how threats and increased likelihood of diseases are strongly linked. I'm going to go to the top right-hand corner, the societal preparedness. What we've seen in the current pandemic is that those who were susceptible to COVID, that there were very strong social gradients, socioeconomic gradients, but also the impacts, if we look at the lockdown measures, a strong socioeconomic gradient. That's where the research from the social sciences comes in. Towards the bottom right-hand corner, the health systems, strong focus on, if we're talking about pandemics, disasters, it will have consequences also for the organization of our healthcare system. Can we go to the next slide, please? Another complex slide. The only message I want to give here is that even though this initiative started in Delft and in Rotterdam, we are well connected both in the Netherlands and internationally. And we want to work with international and national partners. And you will notice that today's speakers are not all only from Delft and from the Erasmus University and from the Erasmus Medical Center. Next slide, please. What's our vision? Keywords here are a systemic view, a long-term view, and a combined approach to pandemics and disasters. Next slide, please. How we have gone about establishing ourselves is through 6 so-called front-runner projects, and we've selected topics where there's a lot of academic debate, where there's uncertainty as to where the literature is going. One is on the links between climate change and virus outbreaks. The second one is on this transmission. So here it's people, the ventilation experts with the transmission experts working together. Then there's the third is on think of what happened in Limburg and in Germany and in Belgium this summer. what lessons can be learned from the flood disasters that happened there for pandemic preparedness and the other way around. Fourth project is the topic of today, and I'm not going to elaborate on that because Martin van Hum will do that. Fifth topic is surveillance. Can we develop early warning systems? And that's where we'll also be working with veterinary sciences, for example. And the last one is scenario development. How can we think about better preparedness? And that's where we will be developing all kinds of future models of the future. That was for my introduction. I would like to now give the screen to Mart van Hum, who will give a brief introduction on this Frontrunner project. Thank you.
Okay, thank you very much, Pearl. You should be able to see my screen now.
Yes, we can.
Yes, okay, great. So thank you very much, Pearl, for introducing the center as a whole. I'm going to present very briefly the Frontrunner project towards social and urban resilience for pandemics and disasters. So the Frontrunner project really starts with the idea that the COVID-19 crisis has deepened all kinds of pre-existing socioeconomic inequalities, but also created lots of new inequalities. And I think that the people that have been hit hardest by the COVID pandemic are those with pre-existing health issues, but also people who live in relatively poor quality housing, crowded housing, houses without any private outdoor space, especially during the lockdown, that was an issue. And of course, people with insecure jobs were also hit quite hard. Generally speaking, disasters, health crises, and also the measures taken to mitigate them, such as, for example, the lockdowns, often hit the most disadvantaged members of society hardest, mostly because they lack the resilience to cope with the crisis and to recover. If you look at the literature on socioeconomic disadvantages, but also disasters such as floods or heat waves or pandemics, then we know a lot about the impact of each of these events on people and societies. But most of the time, these effects are only studied in isolation. So we know a lot about each of these events and the impacts on people, but we don't know a lot about interactions between different disasters. So, and that's really where the idea of compounding effects come in. So when two or more hazards or risks interact, the potential collective effect of these events can be much greater than the sum of its parts. And we call these compounding effects. And these compounding effects are most prevalent in geographic concentrations of pre-existing inequalities. And the idea of compounding effects comes from compounding interest. Well, it used to be the case when you put money in the bank, you got interest on interest on interest. And so there was a multiplier effect. Well, this can also be the case in the case of pre-existing inequalities, and then a disaster hit, and then a pandemic hits, etc. And these additive and cumulative effects of crises imply that certain groups in society cannot recover from one crisis before the next one hits. And this refers back to this idea of resilience. So a lack of resilience can lead to these additive effects. This can be summarized very briefly and simply in this diagram, where on the one hand, on the left, there are pre-existing inequalities like a low socioeconomic status, poverty, unemployment, poor pre-existing health issues, poor housing conditions. And on the other hand, there are impacts of pandemics and disasters like urban heat, COVID, flood risks, but also, for example, the current energy crisis, where some people really do not have the money to heat their house in winter, while maybe the same households also suffer from heat in the summer. Then on top of that, and Rens will talk about this later, we're really interested in mis and disinformation about COVID, about vaccinations, but also about climate change, because this influences the resilience of people and communities. And in the end, our project is interested in creating more agency, improving local infrastructures, and Godfried will talk about this, with the ultimate aim to establish more social and urban resilience. So overall, the aim of the Frontrunner project is to create a knowledge base aimed at identifying social and urban conditions that mitigate the impacts of pandemics and disasters that increase inequalities. So we're really focused on the one hand, better understanding the impact of disasters and pandemics, and on the other hand, better understanding how you can mitigate the impacts of these events on inequalities. The project focuses on urban heat and COVID-19 specifically, partly because the groups that are hit by these events are often geographically concentrated, and they also partly overlap, including older people, people with pre-existing medical conditions, people with limited access to healthcare, and again, those living in crowded or poor quality housing. The Frontrunner project consists of 5 smaller sub-projects, and the first 4 will be presented in a minute after my talk. One on urban heat and inequalities, a second sub-project about spatial and social connectivity in the transmission of infectious disease, a project on mis and disinformation, and a 4th project on agency and local infrastructure to support citizens. And there will be a 5th project, which will be an urban living lab in which all these different projects will come together. So that was it from me, Pearl.
Thank you very much, Marta, for giving this very concise overview of what the project's all about. I would now like to go to our next presenter, who's Marjolein Pijpers, who's in Delft, as you can see by her her background slide.
Thank you very much, Pearl. I will present the first sub-project. I hope you can all see my screen. So this first sub-project is called Hot Summers in Urban and Regional Inequalities. And the objective of this sub-project is to gain a better understanding of the socio-spatial distribution of urban heat impacts on a fine spatial scale. So as we all know, climate change leads to an increase in heat-related morbidity and mortality. And this is especially true for elderly, infants, and people with underlying disease, but also people with low socioeconomic status and other inequalities that Marta just referred to. We also know that there are parts of the urban environment that overheat more than others. However, we lack knowledge where those 2 domains, so let's say the social and the spatial, overlap, so where they come together, especially at the very fine scale, so that's of the dwelling, the street, the neighborhood. So what we need to know are these questions. So which socioeconomic groups are most exposed? Where are they located in the urban environment? How does this relate to the setup of the urban environment, to the design? What compounding risks are related to this exposure? Does this impact behavior, individual outcomes with respect to health? And also, as Martin was saying, what can we learn from this in order to make a better decision making, or at least make a better prioritization of where to mitigate first? So most studies that are there on this topic use land surface temperature as an indicator for exposure to heat. That is understandable. However, it is a far too coarse approach, as land surface temperature is only one aspect of urban heat. You can see here that there are different kinds of urban heat islands, and the urban surface, so that's the third picture, only refers to the temperature of the materials. So indeed, that says something about the possible impact of the house. However, we do not know the insulation, for example, the energy label. One that is also very important is the urban canopy layer heat island effect. So that is basically the air temperature of the air between the buildings, so the outdoors. And as you can see on the picture on the right, these can really differ a lot. So this surface temperature and the air temperature, especially during the day, this is very different. So if you already take these differences into account, you get to might come to a different conclusion. Something else that's also really important is not only surface temperature and air temperature, but the perceived, or let's say the physiological equivalent temperature. And there also wind speed and relative humidity come into play. So this is really the impact of heat on the body, where heat stress is caused. So we propose that we look at least at these 3 indicators of urban heat, but also we refine the scale. So we will use satellite imagery that is now, as you can see at the bottom left, very coarse in scale. So this is, I think, a 90 by 90 meters resolution. Then you don't know anything yet about street and building level. So we will use new technologies to really come to that finer scale, so that we really have this detailed knowledge. We will combine it with spatial information like urban density, building types, energy labels. So really the information on the built environment. And then with individual data from the CBS. So everything we need to know about the individual age, but also health status, behavior, socioeconomic status. And combining these data sets, we believe, will really give us a more detailed, more nuanced, and more complete image of this sociospatial distribution of urban heat impacts. And that will really help us prioritize where to take measures first. Thank you very much.
Thank you, Marjolein, for a fascinating insight into your project and this very clear focus on not the broad, but the very small geographic units. Quickly, I'll go to our next speaker, Luc Coffeng, who is at the Erasmus Medical Center, an expert in modeling, epidemiologic modeling. Luc, the screen is yours.
Thank you, Pearl. So now let's move from the physical realm to the social and biological realm. As Pearl introduced me, I'm an infectious disease modeler with a medical background based at the Department of Public Health. And this second sub-project I'll be running together with Tom Emery at the Department of Public Administration and Sociology and director of the Odyssey platform. This second project is called Spread of COVID Through Social Networks, Lessons for Future Pandemics. This sub-project focuses on spatial and social connectivity of Dutch society. And this is important because in the light of the compounding risks or compounding effects that Maarten referred to, spatial and social clustering leads to these compounding risks by clustering of vulnerabilities. In this sub-project, we ask ourselves how these compounding risks and how spatial and social clustering drive social inequities in transmission and control of infectious diseases like COVID-19 in the Netherlands. And important themes or factors here will be citizen connectivity and agency, but also transmission-related behaviors, health risks, which may, for instance, differ between age groups or socioeconomic groups, as well as response to a policy, so intervention uptake, say vaccination uptake. And for this, we will build models. So we hope to use these to answer the question how we can better address these heterogeneities and vulnerabilities in Dutch society through, for instance, regionally and social network tailored strategies. With this sub-project, we aim to lay the foundations for future real-time modeling for the prevention and control of pandemics. And an important element of this will be to leverage information from large-scale data sources. And this is really Tom Emery's specialty. A very important component will be population network data. A challenge here is to actually safely and rapidly translate large-scale population network mobility data to something that can actually be used in the transmission models that I work with, which I'll talk more about in my next slide. So Tom Emery is the director of the Odyssey platform, which is a high-performance computing environment that processes and analyzes the dynamic network of the whole Dutch population. So this is about 17 million people with about 2 billion connections between them. And these data are collected and curated at the Statistics Netherlands, CBS. And Odyssey aims to, or works on making that accessible, analyzable, and usable. As part of this project, these population network data will be analyzed and segmented into units like neighborhoods or school networks or colleague networks that we can use in our transmission models. And through so-called layer traversal analysis, which refers to connecting different types of networks, so layers, say connecting a school network with a household network, with a network of colleagues or work locations, to identify critical foci in the Dutch population network that constitute compounding risks or vulnerabilities in societies, where either transmission can be very intense or the consequences of transmission might be very bad. On the right side, I'm showing a small example of a mini network surrounding this person called Jan, who lives with who has a partner who together have some kids in light green. Oh, no, sorry, the kids are in red, and they have friends at school. Jan has parents and himself, and they have another child, a sister, who's connected to other people. And CBS has highly detailed data. And of course, the challenges here, because this is so much data, this sub-project focuses to summarize that in a useful and efficient way for the transmission models. The transmission models this is my specialty, mathematical modeling. The challenge here is that existing models are either too simple to provide useful answers to the complex questions that we are facing now, or they are too cumbersome to actually deliver answers in a timely fashion. And on the right, I'm showing an example of a recent model of the Netherlands, a geographically stratified model that we used to answer the question whether locally implemented lockdowns are useful. And although we were able to actually assess this, we are only able to answer it 2 years after the initial wave. So with this package or this sub-projects, we aim to establish the minimum required complexity to develop agile and abstract models for the Netherlands, using the Odyssey platform, capturing within and between neighborhood dynamics, and using high-resolution genomic meta or data and metadata on the spread of COVID-19 in Rotterdam. Some questions that we hope to address are: how can tailored strategies alleviate the suffering and transmission in particular social or geographically clustered vulnerable groups? Should we prioritize vaccination of specific groups, for instance, health workers, system labs? And how can we visualize our findings and the risks that population networks pose? How can we visually communicate that to policymakers and the general population? And that is the end of my presentation. Back to you, Pearl.
Thank you very much, Luc. I think you did a super job of showing, or at least trying to capture, the many interdependencies we have in life. So it's where you work, with who you live, what kind of family relationships you have. We look very much forward to the results, but I understand we have to wait a little bit. I'm going to take you to our next speaker, Rens Vliegendhart from the University of Amsterdam, who has a background in communications, and he will be talking to us about myths and disinformation. Rens.
Thank you, Pearl, and I'm glad to be here and to talk to you about the sub-project that focuses on mis and disinformation, so nicely introduced already by Maarten as one of the antecedents or potential antecedents of the compounding risks that are so central in our project. And if we look at it specifically in the COVID-19 situation, one of the things that has been said over and over again, actually, among others by the World Health Organization, is we not only dealing with a pandemic here, but also with an infodemic. The amount of information that is present in our public realm has increased a lot through all kinds of technological development and the rise of social media, for example. But during this pandemic, it has become extremely clear and salient and visible that basically real time on each and every second, on each and every time point, and also almost on each and every point of the world, you can get a tremendous amounts of information. But the reliability of that information can be challenged, and a lot of different stories, different frames about the pandemic have been present, and not everything is actually factually true. So this is a little bit the starting point of this third sub-project, where we specifically focus on the Netherlands and try to kind of map as a first aim the presence of mis and disinformation. With misinformation, we mean factually incorrect information. With disinformation, we mean that there's also an agency behind that, and that there's actually someone who deliberately spreads that information to reach certain political or social goals, you could say. Well, so we're first of all interested in knowing the presence. Then we also want to know what the effects are, and especially also wanting to know whether those effects actually differ across those different vulnerable socioeconomic groups that have already been mentioned earlier on in this presentation as well. And then as a second or as a third and final aim, we would also like to see whether we can empower people to basically critically identify and be basically resilient towards this information when it crosses their paths. Well, concretely, this means that we break down this sub-project in, again, 3 different studies. And the first one is then focusing indeed on the presence of this information in Dutch social media and in mass media during various stages of the pandemic. And we use all kinds of different types of computer-assisted content analyses. One of them is focusing on kind of relying on previous research that has demonstrated that this type of information is likely to contain different linguistic and also content-related characteristics. And a second approach here might be one that relies on machine learning, using databases where there are a lot of fact-checked stories and pieces of information that can kind of offer a starting point to train a computer to automatically identify incorrect information. Well, then in the second instance, we're interested in knowing what the effects are, and in particular, whether these effects are bigger for certain specific socioeconomic groups. And those effects, with those effects, we focus on things like knowledge, trust, and, for example, also compliance to COVID-19 measures. So here we plan to conduct a few experiments where we basically rely when designing our stimulus material on the findings and the outcomes of the first study, the content analysis. And then finally, as a final step in this project, we try to map the possible interventions or we try to look at possible intervention strategies, trying to build that resilience. And in this particular case, you could kind of talk about digital or media literacy of citizens. And here the concrete idea is to try to develop an app that trains and helps people to identify incorrect information. That was it for me, Pearl. Back to you.
Thank you very much, Rens. What I find fascinating in your project is that you're not just assuming that people live in bubbles, but that you're actually going to see and capture it, and actually, trying to make that visible that people live in bubbles, which hasn't been done before. Going to the last speaker, Godfried Engbers, a colleague in the Department of Public Administration and Sociology, who's going to be talking about public infrastructure. You're muted.
Thank you, Prue. It's a pleasure to introduce to you this small project, but I think it's a project that is also related to the projects we heard before. The title is Local Public Infrastructure and Agency in Times of Disasters. It's based on the cooperation between Erasmus University and Leiden University, Jet Bussenmaker from Leiden University. And I think the origin and the basis of this project, it's based on an ongoing research on the societal impact of COVID-19, financed by ZonNW, also partly with the support of 3 municipalities, Amsterdam, Rotterdam, and The Hague. And I think the basic findings I can, describe them in 3 major observations. One, and Maarten already stated it before, the unequal impact. Specific groups and specific neighborhoods are strongly affected by COVID-19 and also by the corona policies, like low-skilled, low-income groups, specific migrant groups, people with an insecure labor market position, people in poor health, the traditional vulnerable groups, but also some new vulnerable groups. What we witness today is a declining trust in governments, in the central government, but also in local governments and public health institutions like GGD and RIVM. From our research, we have the finding related to the research of Rens that social media may contribute to declining trust and less vaccination readiness. We also see a distrust with regard to evidence of climate change. So a serious problem. We also witnessed yesterday the low vote turnover when it comes to local elections. So this trust dimension is crucial if we think about resilient policies. The sunny side of the research is that, on the other hand, we witness on the local level, at the neighborhood level, enduring social solidarity and all kinds of relevant grassroots initiatives during the COVID pandemic. And it's worthwhile, I think, to combine this kind of findings. So the assumption of the project is, or maybe the starting point is, that we are in need of a public infrastructure that bridges the gap between poor citizens and governments to regain trust, and also that effectively supports citizens' initiatives. We were inspired by a kind of modern classical study on heat wave by Eric Kleineberg, in which he shows that resilient neighborhoods are neighborhoods in which you have this kind of public infrastructure that creates specific forms of social capital, that bonds people, create bridges between people, and also link people, from people, to specific organizations that help them. So, and the question is, what kind of public infrastructure we're talking of? And you can think about neighborhood organizations, public welfare organizations, public health organizations, libraries, the role of housing corporations, not only organizations funded by the state, but you could also think of faith-based organizations, but it's crucial. So the research question is, under which conditions do citizens' initiatives and forms of community participation arise in response to disaster and pandemics in vulnerable neighborhoods, and what kind of public infrastructure are needed to support citizens? As we know, in the past decades, we have witnessed very serious austerity politics when it comes to the social domain, public libraries, public health, and you see a kind of reappreciation, a recognition of the role of this local public infrastructure. So what are we doing? We did already some explorative studies, some previous work on to analyzing relevant citizen initiatives. We will continue with that. We already did a number of focus groups, 11 with specific categories of citizens and also with professionals. That was rather exploratory. We would now have more or less the same focus group, but more theory driven. And part of this project, and we'll learn about it after me, will be a living lab Rotterdam South. We would like to bring in our own experience from our own living labs from the University of Leiden, the Hague Southwest Living Lab, but also the ER Knowledge Lab Livable Neighborhoods. We will work together with the GGD and the Healthy and Happier, the Hague Network, in order to find out what are the basic dimensions of a public infrastructure that makes citizens and neighborhoods more resilient toward disasters and pandemics. Thank you.
Thank you very much, Godfried. Fascinating to see how you draw on a rather classic study in sociology, which was that heat wave in Chicago, where it became very apparent that certain neighborhoods were much more strongly affected than others, and that you're using that as your point of inspiration, your point of departure. Thanks for sticking to time. I'm going to start with a question. I'm going to ask it to each of you, and it's the very first question in the Q&A. And what I noticed while you were talking, and it's the exception is Godfried, but you were all talking about compounding effects, and none of you referred to the topic of the front runner, which is social and urban resilience. And we all know that you have an interest in improving resilience at various levels. So I'm going to ask each and every one of you to relate your project to how you feel it might provide insights to increase resilience at whatever level you want to talk about it. And I'm going to go through the order in which people presented, because I know that that way you each will sort of have the same amount of time to prepare your answer. But Marjolein, I'm going to ask you first.
Yeah, thank you, Pearl. A good question.
It wasn't my question, it was someone from the audience.
I know, an anonymous questioner, even.
Yep.
I think. Doesn't matter. So resilience, I think, is about the capacity to bounce back from an event that was has a negative impact. So in our project, first, to be able to know how to bounce back, you need to first know what the impact was and what caused it. So that would be the first step, knowing where the impacts are, and if they were indeed, if urban design has an influence on this impact. And if we find out where that impact is largest, then we can also make it more resilient. So altering our urban environments through design or redesign or other kinds of measures to improve the resilience in that specific location, with measures that really relate to that specific place, because one measure we already know works in one type of building but not in the other. So that, I think, for our project, that is how we aim at making society more resilient.
That's a very clear response, and it also rings through in where you come from. It's the urban design. I'm going to go to the next speaker, and that was Luc. Resilience.
I think from my perspective as a public health researcher, I can talk about resilience in two ways. First, I talked about these vulnerabilities in the population network of the Netherlands, and the aspect of resilience is to be prepared to shield off those vulnerabilities or address them with specific tailored policies that makes them less affected by whatever is going to happen in terms of a disaster or a pandemic. And the second aspect of resilience is to do these things in such a way that these interventions themselves do not burden the society as a whole unnecessarily. So interventions and public health policy themselves, of course, also pose a burden on society. So by tailoring strategies to particular parts of population, spatially or socially, we can lessen the burden of the interventions themselves, which is also good for resilience in terms of, for instance, say intervention fatigue. I think we can all relate to the fact that we're quite tired of the situation.
Luke, it's as if I don't know if you did it intentionally or not, but it's a wonderful bridge to Rens, and I could see Rens smiling already. So you talk about very clear targeted policies, and I like the word intervention fatigue, and Rens is just jump in, please.
Yes, I'd love to. I thought that I used the word resilience, so otherwise I plan to use it. And I think that in this specific project, it really kind of works towards that in this final step where we have this intervention that focuses on digital and media literacy, where we try to kind of really help people to learn to cope with basically, in general terms, the abundance of information that they receive in such a pandemic/disaster context, and very specifically also try to kind of tailor that towards those groups that are most vulnerable to it. We might in real life have difficulties to kind of identify, critically ask questions about what is correct and what is not correct. And I think that if we are able to kind of even have a small step there in that direction, and also develop in this case, an app, so a tool that can also in future situations be applied, then I think we have a modest but useful contribution to increasing that resilience.
Thank you, Rens. Interesting is that you're focusing on individuals and digital literacy. That's your interpretation, or at least that's your take on resilience.
Well, I think that's a particular take that's in this sub-project is present. Yeah.
Yeah, Godfried, you did use the word resilience.
Exactly. So you were unfair to me. Yes. Okay, but I think I agree with Marjolein that I would define it also as the capacity to cope with, and also the capacity to be prepared. And if you study the literature on resilience, you have, of course, a whole psychological literature focusing on self-control, sometimes or even on personality traits. But in my work, my work will be more on, I think, the institutional dimension of resilience. How to shape institutions in such a way so that people have the resources to cope with. That's the logic behind our project. And we use the word local public infrastructure, but another concept would be, and it's quaint, it's rather unknown by Robert King Merton, it's the notion of public capital. We have the notion of social, cultural, economic capital that can be related to groups. But I think the sum of organizations in a specific neighborhood is a form of public capital. And if people have access to these forms of public capital, then they are more or less, then there can be more resilience if you can shape it in such a way that it's relevant. And I think that's the puzzle behind the project to be solved.
So, thank you, Godfried. I'm going to move away from resilience for a minute, and I'm going to go back to some of the questions in the chat. And now I'm going to start with Luke. You have a very broad model. And what surprised me is that you received questions about whether you should be broadening it even further. One of the questions came from Marion Koopmans, and this was about whether you will be including genomic data in your models. And then there was a question about whether you would be including air quality in your model. Could you please address these two questions?
I'll try to. So let me first say that these models that we develop, they are really aimed at improving our understanding in the first place. Not so much to exactly recreate reality, but understand the dynamics of this complex system that we call society and how diseases and people behave in them. So as for the genomic data and metadata, I hope that these can help us make either informed assumptions about, say, the connectivity between neighborhoods of Rotterdam, These are data from Rotterdam, and they could tell us how related virus infections in different people across Rotterdam are, who might have infected whom, which can tell us something about how likely it is that an infection traverses from one neighborhood to another. So we can use that to inform our data, inform our assumptions in the modeling, or we can use them to validate our assumptions post hoc by comparing model predictions for connectivity based on the social network data with, for instance, the genomic network data. As for air quality, I didn't read the question myself, but I don't envision that we'll explicitly capture air quality as a feature in the model itself, as we're actually trying to come up with an agile model that is not too complex and an abstraction of reality. But I can appreciate that, say, secular trends in air quality might be important for some diseases, but that will have to be captured as a phenomenon, as an outside input to the model, say as a scenario. What if the air quality were to change, and this means for the biology of disease X or the behavior of person Y? We'll just have to make assumptions about that as a scenario.
Okay, I'm going to turn to Martin now for sort of an overall view, or at least a question, an overarching question. What's clear in this project is that you're dealing with all kinds of levels. You're dealing with individual people, you're dealing with neighborhoods, you're dealing with houses, you're dealing with entire social networks, and yet you propose a living lab. Could you explain to us how all the various ideas from the 4 projects, how you plan to test them in this living lab in, I believe, a particular neighborhood in Rotterdam and a neighborhood in Delft, in The Hague? Could you expand on that, please?
Yeah, so thank you very much, Pearl. But I think a living lab, for me at least, is never a construct that evolves around one simple question. I mean, it's a living lab consists of many different interactions with the residents in a particular community or neighborhood. So in my view, a living lab is always based, at least an urban living lab as we see it, is always based in a certain community where you work with the users or with the residents as co-innovators. And it also requires a lot of collaboration between the different aspects of the project as a whole. So the different aspects here. But we have a project about heat. We have a project about COVID. And then 2 of the projects, the one by Godfried, but also the one by Rens, they have already built in more direct links with the users. So Rens wants to develop this app and also test it in the real world in collaboration with the residents in the community. Develop strategies so people can make a difference between good and bad information, for example. But I can also imagine on the project on urban heat of Marjolein that it's really important to compare modeled measures of heat with measured and perceived heat, because those can be very different aspects. And I think somewhere in the question, someone already asked something about the timing. We're not always at home during the whole day, so people move around the city, and maybe the moment when you're at home is not the moment where you have most problems with urban heat. So learning more from the residents in particular parts of Rotterdam South on how they on a daily basis deal with these heat problems. The knowledge they have to mitigate heat-related problems, and whether the models that we use are actually whether the modeled heat that we see is actually similar to what people perceive or not. So it's, on the one hand, we can calibrate our models better by using residents' experiences, but also we can learn from residents on how they develop coping strategies related again to resilience. But also maybe we can help local residents to deal better with these issues of urban heat. Related to resilience, you referred to, you started with the resilience question. I once read about resilience that it's also about the ability to bend, but not to break, and to bounce back. And I think by focusing on the more vulnerable members of society, what the problem in these groups often is that they do not have the ability to bend. They break more easily because they already have pre-existing health issues. They already live in substandard housing. They already have a low income or education, difficulties making a difference between good information and bad information, etc. So this ability to bend but not to break, I think, is a really important element of resilience.
Thank you, Martin. I'm going to turn back to Godfried. Godfried, you plan to focus on vulnerable neighborhoods. Why vulnerable neighborhoods? I mean, what you're doing, wouldn't that be relevant to all neighborhoods? And you also talk about a public infrastructure. I mean, for me, public is government, but public is also outdoors. Could you elaborate on that too, please?
Yeah, the good questions. And no, I think that when we are talking about thinking about a adequate local public infrastructure, it would be wonderful to build it, to have this living lab in Rotterdam South and for a specific neighborhood, to try to build what's already there, what can be better, to invest in what. And this public infrastructure, on the one hand, of course, can be financed by the state and by local government or central government. On the other hand, we also, for example, housing corporations, semi-public, neighborhood organizations are voluntary based, but sometimes a little bit supported by the government. So it's not only state-led organizations. And I do think that when it comes to a kind of public infrastructure, there is a universal basis, for example, which is also relevant for Kralingen, which is the more, wealthy neighborhood in Rotterdam. But I do think there's a difference in, for example, the south of Rotterdam, in which more than 100 nationalities live. Yeah, many low-skilled people. I think they are in need of a kind of different local infrastructure than, for example, other neighborhoods. And I think one of the challenges of the project, not of this particular project, is of course to define what is universal and what is more particular. And I think now, because this aspect of the unequal impact is crucial for this project and for the big program, that's why we focus on Rotterdam South. But I do think that you have that wise policies can also have, we also have to take into account the different populations in different neighborhoods. That can lead also to rather different local infrastructures.
Okay. Given the word neighborhood, I'm going to turn now to Marjolein. And one of the people in the question were asking about, aren't you assuming that people stay put? I mean, people move during the day. But one aspect I was wondering about was, and maybe this is again the resilience. I heard nothing, although you had it in your slides, I heard nothing about green, about gardens, about trees. Will you be taking that into consideration?
Yeah, most definitely. We already see that, of course, areas with green, especially those with trees, are much cooler, and that they can really be a safe haven for people to go to during the day. So that means that you need to design your neighborhoods in such a way that those safe havens or those cool elements are at a walking distance. So that's one thing I also always tell my students. It's better to have a lot of smaller parks scattered over your city than one big central park, because loads of people cannot go to the central park. So indeed, we will really look at what the impact is of these greener areas related to the urban form where they are. So in one type of neighborhood, they might have more impact than the other. And that will also teach us where we can best apply these kinds of measures.
Okay, I'm going to turn to Rens now. This digital literacy app. I mean, we have so many apps. People have, I mean, the sources of information. People. I also saw that Marjolein Koopmans had a question on, aren't people terribly set in their ways? Once they focus on something, they stay there. So how effective do you expect or your digital app to be?
Yeah, I think that this is the key question is indeed how strong do people kind of have, how strong are the opinions that people have, and we very often have the impression that we live in a highly polarized society where everyone seems to have very strong opinions about anything. But this is also a bit of a picture that's being sketched that's basically completely not correct. There's a huge group of individuals that I think is particularly in such a pandemic, and we know that also from some panel research that we conducted in the first months of the pandemic, are basically struggling with the tremendous amount of information that is around, and don't have such strong opinions. And also there you actually see that the vast majority of Dutch people are reasonable people who are, as long as they are given and provided with the right type of information, are willing to comply to regulations and are very modest in their opinions and views. But they struggle, or at least groups of them actually struggle. And I think that this is where we kind of want to tailor our intervention towards, and try to kind of develop indeed this app that serves them. And I don't have the illusion that this will change the lives of hundreds of thousands of individuals, but I think it can also kind of set a standard at some point. And the content in the app might actually be more important than the app itself. What are the things that we can kind of are easy for people to signal information that might not be correct, and might actually help them to kind of navigate in this world where there's like this constant stream of new facts or not really facts types of information. So I think that's a bit of the idea that we have here, and how effective in the end it will be is maybe also a good follow-up study once we've developed the Pearl.
We scientists are always so good at that. We always need more and more and more. Let's see if we can.
If you answer questions, new questions always arise, I think.
True. But I also think sometimes we have to do a better job of synthesizing what we know. Luke, this is coincidence. We have a minute to go, but your response was very much about targeted policies, whereas you're looking at the transmission of the virus. And of course, policies also affected the likelihood of being exposed to the virus. Can you comment on that?
Okay, well, so I think there is use in developing targeted policies because they hopefully benefit the people that suffer most, but also hopefully they would be more effective and less of a burden to the rest of society. Because we have to realize that as a society we are connected, and then if the most vulnerable groups in our society are suffering or suffering from disaster or pandemics, we as a society as a whole pay for it, either in our daily lives or in terms of money. So that's why it's useful, even if the virus is transmitting between people, to just target the most vulnerable spots. Does that address your question?
That's a very nice, I think that you're wrapping up this session very nicely. I want to take the opportunity to thank you for being here, to thank those who were online for joining us online. I saw that there are a couple of questions that have not yet been answered. We will take the time to answer them after this session. Thanks again. I look forward to seeing this project develop. And I find it fascinating to see how insights from such a wide range of disciplines are being brought together to think about the topic of how can we improve social and urban resilience. So on that note, I'm going to finish this session. Thanks a lot for joining us.